My name is Scott Beckman. I'm a physical therapist at Advocate Condell Medical Center, and I have an experience in treating low back care and low back pain. And frequently I'm asked the question, what exercises should I do for my back pain? It's a very difficult question to answer because back pain comes in several different variants as well as differs as people age. So consequently, I'm here today to talk a little bit about different strategies that you might employ trying to treat your back pain that works best for you given your life situation, your age, and your back condition. Again, it's important to realize that there are several different types of back injury and back problems, and so the thought that one size fits all just doesn't work here. The reality is that back exercises are prescribed based upon the back pathology. But I want to give you some generalizations. If in fact you are an elderly person, it's possible that you are developing a condition called spinal stenosis. In order to treat spinal stenosis, the goal is always to try to increase the spaces where the nerves live. By doing that, you can decrease your pain. So typically the person who has spinal stenosis is going to tell us that they hurt worse when they stand, they hurt worse when they walk, and almost always their pain feels better when they sit down. For that particular person, we will usually utilize a group of exercises that are collectively referred to as flexion exercises. Flexion exercises open up the spaces where the nerves live. Typically, these exercises are done in a way in which you contract the abdominals and you flatten the back. So, if in fact you do fit in this category where your back pain is worse when you're standing or worse when you're walking, you're advanced in age, then you might want to think about doing these flexion exercises. Let's say, for example, you have the back problem that you bend down, you pick up a piece of paper from the floor, and your back goes out on you. You are laid up for 3 days. You can do absolutely nothing because your back hurts so badly, so you are bedridden for those 3 days. That usually represents a condition that we would call spinal instability. What happens is that the vertebrae move a little bit too much. You bend down doing an innocuous task such as picking up a piece of paper. The vertebrae move too much and move in an awkward way, locking up the spine. You're left with 3 days of disability and unable to do anything for those 3 days. That person usually will come to me and say, okay, how do I prevent this from occurring again? The trick for that person is to work on a group of exercises that are called spine stabilization exercises. One thing to remember, when spine stabilization exercises have been done in the past, everyone historically has talked about doing sit-ups, crunches, and those type of exercises to strengthen the back. And there is some evidence, and it's pretty long-standing evidence, that maybe the exercise that you do not or should not be doing is the crunch or the sit-up. Since the mid-1960s, there's been evidence stating that we probably are hurting our backs by doing sit-ups and crunches. That for that person, so the first thing I will always do is saying, if that's been your strategy in the past, you probably need to stop doing that strategy. Rather, for that person who has that type of history, doing a plank, an abdominal plank, which there are different versions, and the one that I will usually go with is one where you are on your stomach and you're just up on your elbows and your toes, holding your spine perfectly still. That's called an abdominal plank. The reason why that's so important is because it starts to recruit the abdominal muscles as well as stabilizes the spine. There's no vertebral motion, and so you don't run the risk of throwing your back out doing that particular exercise. So if in fact you're the person that has those 3 bad days after you bent down to pick something up, you might want to think about going with an abdominal plank, but maybe more importantly, stop doing the sit-ups and the crunches. If you're a person who has, let's say, for example, you're a very flexible person. You might be a woman under 40 years of age. There's evidence for that person who, again, has lots of flexibility, doesn't need to continue to work on flexibility, probably, again, should work on spinal stabilization, working on the plank, working on strengthening the low back muscles themselves. So if you're a woman who has great flexibility under 40 years of age, again, seeking ways to stabilize your spine because it might be that the spine moves a little bit too much. The last category of exercises that I want to talk about, or the last category of problems that people have, a lot of times people have recurrent sciatica, or they know that they have a herniated disc. Again, for the patient who has the herniated disc, I would strongly suggest you stop doing crunches and sit-ups, because what is known, what those studies since the mid-1960s have proven, is that when you start doing those exercises, it pushes the disc further back onto the nerve root, thereby making your sciatic nerve symptoms worse. So what ends up happening, in good faith, people who think they are helping themselves by doing this particular exercise strategy are actually making themselves worse. So if in fact you've been diagnosed with a herniated disc and you have that rip-roaring bad sciatic symptoms, my suggestion, stop doing the sit-ups, stop doing the crunches, and work on strategies that will unload the spine. And again, the plank exercise is at least a good place to start. Last but not least, with the person who has the sciatic symptoms, one of the popular misconceptions is that they should stretch their hamstrings to help their back. The reality is that when you have radiating pain into the leg via sciatica, the problem with doing hamstring stretching, a remedy that's oftentimes prescribed, you have to realize that you are also stretching the sciatic nerve when you're stretching the hamstrings. So again, in good faith, people try to work on stretching the hamstrings to try to treat their sciatica. The reason why they get fooled is because when the sciatic nerve is irritated, the hamstring muscles will oftentimes go into a protective tightening down, making you feel like you should really be stretching your hamstrings. But the problem is you're now introducing a stretch through a nerve that's already irritated. A suggestion would be, if you're having bad sciatica and you feel that hamstring tightness, don't stretch the hamstrings. They'll get better as time goes on. Avoid trying to make the problem worse when you're actually trying to make it better.